Yes, good evening. Good evening, Kapil, Aditya, Raja, Satyashri. Good evening. Good evening. Dhanashri, Garima, Sonu, good evening. Good evening. Before starting the session, just give me a thumbs up from your side that the audio and visuals are absolutely fine. Yeah, Sai Krishna, good evening, beta. Good evening. Welcome to the session on anatomy of the stomach part 2. Angel Matthew says, yes, sir, it is okay. Dimple D, good evening, beta. Good evening. Aditya, I hope it's perfect. Perfect. Rutika Nayak, good evening, beta. Good evening. Yes. Everyone, yeah, Garima, Nitin, Dimple, very good, beta. Let's just start the session. We were discussing the relations of the stomach. We have already covered the peritoneal relation, that is the ligaments wala part, and we have already discussed the visceral relations yesterday. Now today I will be focusing on the posterior relations of the stomach, and that is something which is called as the stomach bed. Yes. Good evening, Sanjana. Very good. Very good, guys. I hope everyone is like attending the session. So, yes, I hope you all are writing the notes along with me. So, yes, without wasting much more time, let us just start the session. So, before coming to the diagram which is given in the atlas, so let us draw our own diagram. Let us draw our own diagram. So, just see the posterior relation. Okay, what is present behind the stomach? Okay, what is present behind the stomach? Let us first draw all the structures that are present behind the stomach. Okay, so you already know that yeah, we have something which is called as the transverse colon, right? This is the ascending colon. This is the transverse colon, and we already know we have descending colon. So the transverse colon is covered by something which is called as the transverse mesocolon. Okay, it is covered by transverse mesocolon, right? Mesocolon already I have discussed yesterday, right? So it is the transverse mesocolon. Yes, Raja, I will discuss it. Fazila, good evening, guys. So yes, now above the transverse mesocolon, what you will see is the pancreas, guys. Yes, you will see the pancreas, right? So I'm just trying to draw this. Yes, or you can just draw. Whatever topic you want beta to like me to start, just write in the chat box. Let's see what the majority speaks, and then I will continue with that topic, right? I will continue with that topic. So this is the pancreas beta that I have drawn. Now on the side we have the, okay, on the left side it is the spleen that is present. Now to the spleen basically the kidney is present. Okay, and above the kidney you already know we have something which is called as the suprarenal glands. We already know we have suprarenal glands, right? Good evening, Satan. Good evening, Ravinder. Very good. Welcome to the session. So yes, let us just label it, guys. So you already know this is the, okay, I will try to make it nicely. So yeah. Yes, so this is the pancreas. Yeah, this is the transverse mesocolon. Transverse mesocolon. This structure, it is the spleen. Okay, this is the spleen. We have the kidney, okay, just behind it, the kidney. And you already know the kidney is covered with the suprarenal glands, right? So we have the suprarenal glands. So yeah, in totality, these all structures are present over here, and we already know. Can anyone tell me in the yes, can anyone tell me in the chat box which structure or which artery will supply the spleen? I want the name of the artery which will supply the spleen, and also uh, that artery will arise from where. So I want both the things in the chat box. Pranay, good evening. Pranay, good evening. So I want both the things over here. Yeah. So just tell me which artery will supply the spleen. So yes, and I have already told you that it is a tortuous artery beta. Yes, it is a tortuous artery and it will supply the spleen by giving 6 to 7 hilar branches. I hope you already know this, right? No one is answering what has happened, beta. Yeah, answer do फटाफट से. Yes. Ha, sister, very good. It is the splenic artery. Yes, it is the splenic artery, right? And we already know the splenic artery, it is coming from the celiac trunk. So yes, this you have to remember that this artery, it is the splenic artery. Yes, very good, Garima, very good, Kapil, very good. Splenic artery, and this artery, it is coming from the celiac trunk. So you already know that we have already discussed in the previous sessions. Now, these all structures are located behind the stomach. Okay. Now, coming on to, okay, let us draw the stomach. Let us draw the stomach, and yes, on this. Yes, very good, Sanjana, very good. Let us draw the stomach, guys, on this particular picture, and I would ask everyone to draw it. Okay, I would ask everyone to draw it like, okay, with dotted lines, although it is behind, but yes, we have already drawn the structures with like full line diagrams. So I want you to draw, right, dotted. Okay, so I want you to draw it dotted. Okay, so that it is covering all the structures, right? It is covering all the structures. Like this. Okay. Now, what I wanted to tell you that it is covering a small part of the transverse. No, it is covering transverse mesocolon, but a small part of this. Okay. Can anyone tell me this part? What is this exactly the part of the colon called as? I've already explained you. Can anyone tell me what exactly this part which I have highlighted? Part of the colon. Yes, which flexure it is? Which flexure it is? Okay, so yes. Hmm. Already I've drawn a little above, so you should know it is the splenic flexure of the colon. Okay, so yeah. Splenic flexure of the colon, that is also like covered. Okay, so yes. So now, how to remember the posterior relations, guys? There is a very good mnemonic that is like followed everywhere. So I want you to learn this from this particular mnemonic, that is Dr. S kills patients mercilessly. Okay, Dr. S kills patient mercilessly. D basically stands from for the diaphragm. Okay, diaphragm covering is also there towards the fundus part of the stomach. So you can draw the diaphragmatic part over here. Yes. And which crus of the diaphragm, beta? Which crus of the diaphragm? Can anyone tell me in the chat box which crus of the diaphragm it will be? Okay, so it is the diaphragmatic part. And which crus of the diaphragm? So yes, it is the diaphragmatic part. Yeah, diaphragm. And which part of the diaphragm? Yes, very good, Anushka. Very good, beta. It is the left crus of the diaphragm. It is the left crus of the diaphragm. Beyond that, you already know the three structures, beta. We have the spleen. Okay, the spleen. We have the splenic artery, beta. Splenic artery. And you already know splenic artery, it is tortuous in nature, right? I've already explained you. It is tortuous in nature. Okay, that helps in distension, right? Good evening, fun mode. Welcome to the session. Yes, left. Very good, Aditya. After that, you should remember, beta, we have one more S, and that is the splenic flexure of colon. Yes, or splenic flexure of colon, or that is also called as the left colic flexion. That is also called as the left colic flexion, right? Now, K basically stands for kidneys. Can anyone tell me which kidney will be involved? Can anyone tell me which kidney will be involved? Yeah, I'm waiting for your answers. Can anyone tell me which kidney will be involved? ये पहले वाला आंसर है, right? Yeah, very good Anushka, very good beta. It is the left kidney which is involved. Okay, the left kidney, and more specifically beta, it is the anterior surface of the left kidney. Okay, it is the anterior surface of the left kidney which is involved. Apart from that, yeah, along with the kidney beta, you should remember kidney kabhi akela nahi aayega. We have the suprarenal gland, and this suprarenal gland, it is the left one, the left side. Yes, obviously Kapil, very good. Left. Kriti, Krisma, very good. Atya, very good. Now, P basically stands for beta pancreas, and we have the peritoneal folding, that is the mesocolon. And which mesocolon it is? It is the transverse mesocolon. Transverse mesocolon. So that is how you can remember with the help of one diagram and one mnemonic, the stomach pet relations. Okay, draw the diagram first, right? So yes, the splenic artery, spleen, kidney, suprarenal glands, left crus of the diaphragm, pancreas, transverse mesocolon, and splenic flexure of colon. So these are all the parts that are involved, and I hope this is clear to everyone in one single diagram, in one single slide. So just give me a thumbs up if this is clear to everyone. Yeah, so just give me a thumbs up if this is clear to everyone. So yes, Garima says yes, it is clear, sir. Perfect beta, perfect. Chal, बाकी भी बताते रहिए. Dimple, very good. Dimple, very good. Now beta, if this is like race anatomy diagram. Yes. Aditya, Sai Krishna, Angel, Kriti, Anushka, Krisma, Nitin, Satyashri, Divya, very good beta, very good. Try to attend the session along with me, write the notes along with me so that it's easy. So beta, you can see the pancreas over here, right? You can see the pancreas over here. Okay, you can see the transverse mesocolon. Basically, the stomach is removed and we are just able to see these structures. You can see the spleen over here, right? You can see the spleen over here. Yes. You can see the splenic artery beta, the splenic artery. It is going towards the spleen and like it is branching into 5 to 7 hilar branches, right? So yes, these are the structures that are like visible over here. So yes, beyond that, this is the same diagram that we have drawn just right now. So no need to like ratify this. Already we have discussed it. So now it's clear. So let us start with the next topic, that is the arterial supply of the stomach. That is the arterial supply of the stomach. Already I have discussed this in detail, guys. So just okay, giving a quick recap, you already know we have the left atrium. From the left atriums, to the students who are absolutely new over here, so you should remember this, that I always start with the left atrium, left ventricle. Then we have aorta. Aorta is also divided into ascending aorta. Then we have arch. Arch banata hai aorta, arch of aorta, and then we have descending aorta, right? So between the left ventricle and the aorta, we have a valve that is called as the aortic valve. We have the valve that is called as the aortic valve. Now this aorta, okay, below the level of the diaphragm, it will be called as which aorta beta? It will be called as the abdominal aorta. It will be called as the abdominal aorta. Already I have told you about the various branches of the abdominal aorta, right? Yes, fun mode, very good. Already we have discussed the various branches of the abdominal aorta, and specifically when we talk about the ventral branches, okay, ventral branches and mostly the visceral branches, okay, they are something which will supply the organs of the abdomen, and specifically the artery which is supplying the stomach. Okay, stomach is a part of foregut. Now you guys are going to tell me which branch of abdominal aorta, okay, will supply, means the arteries that are coming to the stomach will come from which branch of the abdominal aorta? I want the answers in the chat box right now. Yes, Anushka, very good beta. It is the celiac trunk. It is the celiac trunk. Very good beta. So you already know we have the celiac trunk which supplies the foregut. So let us just start with our like our diagram from here. Yeah. So yes, you already know this is the abdominal aorta, and in the abdominal aorta we have this, yeah, we have this celiac trunk. And let me draw the stomach. Okay, let me draw the stomach for you people. So yes, stomach तो आदत डाल लो draw करने की. Yes, everyone is right. Aditya, Kapil, very good beta. So yes, now you already know we have a structure just behind the stomach, and that is the spleen, guys. That is the spleen, right? Now tell me the branch of the celiac trunk. Now this is the abdominal aorta. This is abdominal aorta, right? And abdominal aorta, the ventral branch, ventral मतलब आगे की तरफ से आएगी, it will come from the front. This is the celiac trunk, right? This is the celiac trunk, and from the celiac trunk has three branches. Now I will concentrate on one of the branch. Yes, can anyone tell me the name of the branch, beta? Yeah, the very first branch of the celiac trunk that we already discussed multiple number of times. Yeah, anyone? Yes, it is the left gastric artery. Very good, beta. So yes, you already know. Okay, so let me just इसको थोड़ा सा और कर्व बना देता हूँ, नहीं तो फिर कहोगे ये बहुत ही स्ट्रेट स्टमक लग रहा है. So yes, so yes, you already know that we have the left gastric artery. Very good. Everyone is right. Anushka, Aditya, Kapil, very good. So yes, this left gastric artery will come from the celiac trunk, okay, and it will supply the lesser curvature of the stomach, right? It will supply the lesser curvature of the stomach. So this is the left gastric artery. So I will mention it over here. Yes, it is the left gastric artery, right? Left gastric artery. Gastric artery also supplies to the lower end of the esophagus. It also gives esophageal branches. Okay, it also gives esophageal branches to the lower end of the esophagus. That is not our point of concern right now. So yes, we have discussed the left gastric artery, right? Now another artery, okay, which is going towards the spleen and giving off several branches. Tell me the name, beta. Fastly, tell me the name. The other branch which will supply the other arteries which will supply the stomach will come from which main artery now? Yes. Chali. So this is the left gastric artery, right? It's supplying the lesser curvature. You already know this is the lesser curvature of the stomach. This is the greater curvature. This is the fundus part of the stomach, right? This is the fundus already discussed in the yesterday's class, right? Yes. Splenic artery. Very good, Karima. Very good, Kriti. Very good, Karima. Very good, Kriti. Beta, we have the splenic artery. So remember the splenic artery, it is a tortuous artery. Okay, it is a tortuous artery and it runs behind the stomach. We just see it is in the posterior relation. It is in the posterior relation, and it will like branch into 5 to 7 hilar branches will be there, right? 5 to 7 hilar branches will be present, and it will supply the spleen. Now you already know this is the splenic artery. This is the splenic artery. So this is the splenic artery. Now we have this 5 to 7 hilar branches. Hilar branches. Jessita, very good. And you already know this is the spleen. This is the spleen. Now, this splenic artery towards the end of the greater curvature, it will give 5 to 7. Okay, it will give 5 to 7 branches. It will give 5 to 7 small branches, and it will supply the stomach. And this is one which are called as, yes, anyone? This is the one which will be called as the short gastric arteries. Yes, this will be called as the short gastric arteries. Short gastric arteries. Now, if I ask you, short gastric arteries are branch of? Short gastric arteries that supply the fundus of the stomach, they are branch of? Tell me. Yes, short gastric arteries, everyone is right. These are approximately like these are also 5 to 7 in number, right? These are also 5 to 7 in number, and you should remember they supply the fundus of the stomach. They supply the fundus of stomach. So that already I have discussed, right? Yes, it is branch of what, beta? Half one more. Splenic artery, splenic artery. Right, right, right. Now the splenic artery will give a branch towards the greater omentum, right? So yeah, this branch, beta. Yeah, everyone is right. Kapil, Dimple, Aditya, Krisma, very good. Everyone is right. So yes. Now it will again give a branch. This splenic artery will again give a branch towards the greater curvature, and this branch, it is called as the left gastroepiploic artery. Okay, this is called as the left gastroepiploic artery. Okay, epiploic artery. एपिप्लोइक का मतलब और कुछ नहीं, इट्स अ पेरिटोनियल फोल्ड. ओके, ग्रेटर मोमेंटम वाला पार्ट. या लेफ्ट गैस्ट्रो एपिप्लोइक आर्टरी, लेफ्ट गैस्ट्रो एपिप्लोइक आर्टरी, राइट. नाउ नाउ बेटा टेल मी अगेन द थर्ड ब्रांच ऑफ द सीलियाक ट्रंक. फटाफट से चैट बॉक्स के अंदर बता दो, व्हाट इज द थर्ड ब्रांच ऑफ द सीलियाक ट्रंक? व्हाट इज द थर्ड ब्रांच ऑफ द सीलियाक ट्रंक? जल्दी से बताओ चैट बॉक्स के अंदर, फटाफट हाथ चलने चाहिए तुम लोग के. आई वांट क्विक आंसर्स फ्रॉम एवरीवन. Right, so the third branch, yes, it is the, tell what is the third branch of the celiac trunk? Again, the blood supply is yet not completed. Chalo, Anushka, very good beta. It is the common hepatic artery. Now this common hepatic artery will divide into hepatic artery proper. Okay, it will divide into hepatic artery proper. Okay, and it will divide into, yeah, yes, the gastroduodenal artery, right? It will divide into the gastroduodenal artery. So yes, I'll just draw towards the, yeah. चलो सब सही हो, कोई दिक्कत वाली बात नहीं है. एवरीवन इज राइट. यस, अब मुझे बता दो कि अरे ये इरेज हो गया. आई कैन लाइक so yes, okay, it got erased, right? Right, okay. Now guys tell me, there is a question to you while I'm drawing the diagram. So right gastric artery is a branch of 75% cases में क्या होता है, 25% cases में क्या होता है? So I want you to like tell me कि 75% cases में क्या होगा और 25% cases में क्या होता है. चलो जल्दी से बता दो चैट बॉक्स के अंदर. या proper hepatic, it is 75%. Yeah, 75% of the population. Yeah, we have this proper hepatic artery, right? We have this proper hepatic artery. Yes, whereas Varun Kashyap, very good, very good. 25% common hepatic से हो गया. ठीक ठीक है. कपिल, very good. अनुष्का, पीयूष, very good. Varun, Anakala, very good बेटा. So yes, remember that we have this okay, the common hepatic artery which is dividing into the hepatic artery proper, and we have the gastroduodenal artery, right? Now from the hepatic artery proper, the branch will come and supply the lesser curvature, okay, and it is called as the right gastric artery. Okay, it is called as the right gastric artery. So let me just label it for you people so that it is clear that the third branch coming from the celiac trunk, it is the common hepatic artery. So you should know it is the common hepatic artery. Now this common hepatic artery, it is dividing into hepatic artery proper. I'm not drawing the liver part because we are not discussing it right now. Hepatic artery proper, and we have this one that is called as the supra, or yeah, it is the gastroduodenal artery. Yeah, supra is very a small branch that is just supplying the first part of the duodenum. So yes, it is the gastroduodenal artery. Gastroduodenal artery, and yes, now this artery, it is called as the right gastric artery, which is coming from the hepatic artery proper. Right gastric artery, which is coming from the hepatic artery proper. Now, can anyone tell me the right gastroepiploic artery will come from? Okay, the right gastric epiploic artery will come from. चलो हाँ ठीक है फन नोट GDA तुमने लिख दिया है. So yes, it divides into the superior pancreatico-duodenal artery, and it will give a branch towards the greater curvature. And this branch, beta, you should remember, it is the right gastroepiploic artery. Right gastroepiploic artery. Right gastroepiploic artery. I hope this is clear to everyone. So the gastroduodenal will divide into superior pancreatico-duodenal artery. That is not our concern right now. Okay, superior pancreatico-duodenal artery, and right gastroepiploic artery. Okay, right gastroepiploic artery. So yes. Now, tell me the number, guys, in the chat box. I want the numbers. How many arteries are supplying to the stomach? So I will just highlight it so that it becomes easier for you people. So yes, the first one, it is the left gastric artery, beta, coming from the celiac trunk directly. So one branch, it is the left gastric artery. The second branch, beta, short gastric arteries, which are branch of splenic artery. Okay, the splenic artery, okay, towards the greater curvature, it will divide into short gastric arteries. Again, these are 5 to 7 in number, and again the splenic artery will give off a branch which will supply the greater curvature, and that is the left gastroepiploic artery, right? So left gastric artery, short gastric arteries, left gastroepiploic artery. Again, another branch coming from the hepatic artery proper, it is the right gastric artery. Okay, so that is the fourth one, and one branch from the gastroduodenal artery, it is the right gastroepiploic artery. So in totality, 1, 2, 3, 4, and 5. Yes, everyone is right. Anushka, Farmod, Krisma, Sanjana, very good. Very good. I hope you all understood the arterial supply of the stomach, beta. Just give me a thumbs up in the chat box that this particular part you have already understood. So if I just want to show you beta, if I just want to show you, you can just see it over here. You can see it over here, right? So yes. In this particular picture, beta, I just want to make it so clear for you. Can anyone tell me the name of this artery, beta? I will not tell you. I'm marking this with A. Just see the shape of this artery. This is the image which is given in the atlas, and I want every one of you to answer the labelings right now. We have drawn our diagram. Now let us try to put all that we have drawn into this particular diagram. Yes, it is the splenic artery. Very good. Sare samajhdar ho gaye. Anushka, Dimple, Funmood, Karima, Satyashri, Varun. Very good. Very good, guys. Now, can anyone tell me what is this organ, beta? Which organ is this that I have marked with B? Can anyone tell me which organ is this which I have marked with B? Shall it's the spleen. Very good, very good. ये तो splenic artery हो गया और ये हो गया हमारा spleen. ये हो गया हमारा spleen. Okay. Now guys, can anyone tell me, okay, the name of this artery beta, the name of this artery which is supplying towards the lesser curvature? Tell me guys, the name of this artery which is supplying towards the great lesser curvature. चलो जल्दी से बता दो. हाँ, लेफ्ट gastric, वेरी गुड. चलो ठीक है. ये वाली आर्टरी बता दो कौन सी होगी, द वन विच आई एम मार्किंग विद द डी पार्ट. The one I'm marking with the D part, which artery will be it? Yes, everyone is right. Everyone is right. I want every one of you to just look at the image very carefully, right? Hmm. Chalo. Yes, the right gastric. हाँ, हाँ, right gastric epiploic artery. ठीक, ठीक है बेटा. So that's all you just need to know. और बाकी सब तो atlas में दिया ही हुआ है. So already what we have drawn, I've just tried to show over here, right? So yes, I hope this is clear. Now this is the same diagram that is like drawn. So yes. Celiac trunk. So you can see it is given, it is like common hepatic artery. Then it is dividing into the proper hepatic artery and the gastroduodenal artery. So from the proper hepatic artery, this artery is coming, that is the right gastric artery. Okay. So I hope this image is clear. Already we have drawn this image over there. So just give me a thumbs up in the chat box that the arterial supply is clear to everyone. Two topics we have discussed in half an hour: the posterior relations, okay, of the stomach bed and the arterial supply of the stomach. Right now, chalo Aditya, Kriti, Angel, Garima, very good, beta. Anushka, very good, beta. Now starting with the now starting with the venous supply beta. Venous supply. Now, can anyone tell me the names of the veins which are like the main venous drainage of the stomach? Chal, the main venous drainage of the stomach. Again, I will try to draw my own diagram and then I will try to highlight it from the picture that is given in the atlas. So yes, so let us draw this diagram. चल, let us draw. हाँ बिल्कुल ठीक है. लेफ्ट एंड द राइट gastric vein. मेजर वेन्स बता दो जिसमें ये ड्रेन करती. Meanwhile, I'm just drawing the stomach type, the major veins that like चलो हाँ, वेरी गुड. सुपीरियर मेसेंट्रिक वेन है और हाँ ठीक है. चलो जिसको नहीं पता अभी अभी सीख लेंगे. नो नीड टू वरी गाइस, absolutely no need to worry. So behind you already know we have a structure. Yes, we have a structure like that is the spleen. That is the spleen, guys. Right now, you already know this is the spleen. You already know this is the lesser curvature. This is the greater curvature. I will not mark it every time. Now this is upper part of the greater curvature is the fundus of the stomach, right? So you already know we have the short gastric veins. Now we have short gastric arteries. Similarly, we have the short, yeah, we have these short gastric veins which are draining into these splenic veins, right? Which are draining into the splenic veins, right? So first, let us just try to draw the splenic vein. So yeah, splenic vein will run like now this is the splenic vein, guys, right? This is the splenic vein which is running behind. So yes, this is the splenic vein. Now we have the short gastric veins. We have these short gastric veins which will drain into the splenic vein, right? Which will drain into the splenic vein. And yes, they are coming from this fundus of the stomach. So yes, so they are draining the blood into this splenic vein. So yes, these are coming from the fundus part, right? Now we have the, can anyone tell me the name of this vein which will drain into the splenic vein? The one which I have just drawn right now in the chat box? Yeah, this vein. Hmm. So you should know beta, it is the, बता दो, left gastroepiploic vein. Yes, it is the left gastroepiploic vein. Very good. तो अभी तक you guys will answer me कि short gastric veins. Okay, these are the short gastric veins and left gastroepiploic vein will drain into which major vein? Short gastric veins. Now you answer the question. Yes, they are draining into which vein, beta? Now, fun mode, very good. It is the splenic vein. Now, yes, behind, yes, everyone is right. Dimple Di, Varun, Satyashri, Krisma, Aditya, Kriti, very good, very good. बहुत fast answers are रहे. Now, guys, behind the neck of the pancreas, basically the splenic vein will meet. And you already know there is one more vein that I'm drawing. Can anyone tell me the name of this vein, beta? That will meet behind the neck of the pancreas, which will meet behind the neck of the pancreas. That's why I'm drawing it dotted. Yes, the splenic vein. And yes, Varun Kashyap, very good, beta. It is the superior mesenteric vein. Yes, it is the superior mesenteric vein. So you should know it is the superior mesenteric vein. Now, splenic vein and superior mesenteric vein will combine together, okay, to form the portal vein behind the neck of the pancreas, right? Behind the neck of the pancreas. Yes, it will form the portal vein behind the neck of the pancreas. And this portal vein will again divide into the left and right branches, you already know. So this is the portal vein formation behind the neck of the pancreas. Behind neck of pancreas. Right? So now you should remember, beta, what is the superior mesenteric vein here for? Now you should remember that the superior mesenteric vein, okay, will receive the drainage from the greater curvature, okay, and the name of this vein which is draining into this superior mesenteric vein, it is right gastroepiploic vein. It is the right gastroepiploic vein. It is the right gastroepiploic vein. Very good, beta. It is the right gastroepiploic vein. Very good, very good, very good. Okay, now again, two veins are left which are directly giving, yeah, which are directly draining into the portal vein. And remember, beta, it is the left gastric vein and the right gastric vein. So remember, we have two veins which are directly draining into the portal vein. Yes, yes, beta. It is the left gastric vein and we have the right gastric vein. Right gastric vein, which are directly draining into the portal vein, which are directly draining into the portal vein. I hope this is clear, beta. Till now, this is clear. Just give me a thumbs up in the chat box. All the venous drainage is clear to everyone. The major venous drainage of the stomach, basically, it is the portal vein and the splenic vein. It is the portal vein and the splenic vein. Dimple D, very good. The splenic vein and the superior mesenteric vein are the major ones. And yes, the portal vein, it is also receiving secretions, drainage from the right gastric and the left gastric part. We have the short gastric veins which will drain into the splenic vein, right? Which will drain into the splenic vein. Veer, Angel, Aditya, Varun, Krishma, Sanjana, Armish, Sai Krishna, Dara, Satyashri, Farmod, Anakala, very good. And we have the right gastroepiploic which will drain into the superior mesenteric vein. Okay, the left one, it also drains into the splenic vein, right? So I hope this picture is pretty clear. One more thing that I want to discuss over here. Okay, so that it is okay. Yeah, a vein, beta. This is something which I want to discuss. Yeah. Now, a vein which connects the right gastric vein, okay, right gastric vein and the splenic vein. Now, this vein, can anyone name this vein, beta? Can anyone name this vein? Already you know this vein. I have discussed it yesterday, which is having a direct connection. Lima, very good. Which is having a direct connection between the splenic vein and the right gastric vein. It is called as the pre-pyloric vein of Mayo. It is the pre-pyloric vein of Mayo. Another landmark, beta, where you will find the pyloric part of the stomach. Another landmark where you will find the pyloric part of the stomach. Right? Yes, Mayo vein. Very good. Pre-pyloric vein of Mayo. Yes. I hope this is clear to everyone. Now, let us just see the picture that is being given in the atlas, and you are going to label for me. Can anyone tell me? Okay. Can anyone tell me what is 1 over here, beta? What is 1? Okay. What is 2? What is 3? What is 4? What is 5? चलो फटाफट से बता दो all the 5 labelings in the chat box. एक एक करके सारे बता दो जल्दी से. I don't have to rush, but I want every one of you to answer this question. Labelings आनी चाहिए. Labelings are like you should know. One, Dimple says it is the left gastric vein. Okay, beta. What about the rest one? Anakala says 1 is the right gastric. हाँ, वेरी गुड अनकला, यू आर राइट कि लेफ्ट वाली तो देखो पीछे से जा रही है. Beta, both are draining into this particular structure. Can anyone tell me what is this structure? What is that I have marked with A? चलो फटाफट से A बता दो क्या है. फटाफट से A बता दो पहले क्या है. What is A over here? Yes, very good fun mode. It is the portal vein, beta. It is the portal vein. What is the fourth one? Fourth one, Anushka has already told that it is the short gastric veins. Okay, short gastric veins are draining into what? This is, which structure is this which I have marked with B? Which structure is this which I have marked with B? What is this vein? Yes. हाँ, fundus कहाँ से आ गया इसमें? हाँ, splenic vein है. Very good fun mode. Very good. Yes, splenic vein है. Dimple, very good. ये splenic vein है. अब okay. Now, can anyone tell me the name of this vein which is marked with C? Use your brains, beta. I want everyone to use your brains right now and tell me the structure which I have marked with C. The structure which I have marked with C. Fun mode, very good, beta. It is the inferior mesenteric vein. I already told you it drains into the splenic vein. It is the inferior mesenteric vein. सब लोग superior mesenteric तो बेटा behind the neck of the pancreas formation हो रहा है ना, duodenum का, वो portal vein का. Inferior mesenteric vein drains into the splenic vein. इतना बताया था ये मैंने तुम लोगों को, इतनी बार बताया है. अब बताओ, इसमें भी गलती करोगे तो फिर क्या होगा? थर्ड वाला बता दो, थर्ड बताओ जल्दी से, क्या है? व्हाट इज थर्ड बेटा? व्हाट इज थर्ड? What is third? Yes, yes, very good, Karima. It is the left gastrocapiploic vein. Very good, Karima. Dara, हाँ, वो वाला ठीक है. Okay, everyone is right. Anish, Satyashri, Aditya, very good. Now, beta, tell me, अगर ये inferior mesenteric vein है, तो what is the structure that I have marked with E? What is the structure that I have marked with E? जल्दी से बताइए, what is the structure that I have marked with E? चल, superior mesenteric vein. Very good, very good. One more. Angel, Anushka, Anakala, Sanjana, Aditya, Garima, Dimple. I mean, perfect बेटा, सब perfect हो गए लेबलिंग में, अब बिल्कुल perfect हो गए हैं. हाँ, चल, चलो, मेजर मेजर चीजें पता चल गई हैं सबको, ठीक है. लेबलिंग गलत नहीं होगी अब तुम लोग की एग्जाम में, ठीक है. चल, now we have already discussed the venous drainage, we have discussed the arterial supply. Now coming on to the lymphatic drainage of the stomach. Now to understand this beta, to understand this, let us try to draw our own diagram, and then we will look the diagram from the atlas as well. Okay, so again I will try to draw the stomach. Okay, I will just try to draw the stomach. So now, guys, to understand the lymphatic drainage beta, to understand the lymphatic drainage, what you have to do first? No, everyone knows that this is the lesser curvature of the stomach and this is the greater curvature of the stomach. The lesser curvature, it is the right border of the stomach, and no, this is the, okay, let me mark it. This is the right side, okay, and this is the left side. So yes, the greater curvature is also called as the left convex border, and the lesser curvature, it is also called as the right concave border of the stomach, right? Right concave border of the stomach. So now what we have to do, the very first step beta, what you have to do, you have to draw. Okay, you have to draw an imaginary line just to understand beta how the lymphatic drainage take place. So we have to draw an imaginary line, okay, dividing the stomach. So draw an imaginary line dividing the stomach into left 1/3 and right 2/3 along the or I can say along the curvature of the stomach. सीधा नहीं, it is along curvature of the stomach. जैसे जैसे curve जा रहा है वैसे वैसे you have to draw the line along curvature of the stomach. Now what is it, guys? So you already know we have the right part and the left part. So we have to draw a imaginary line along the curvature of the stomach, not straight, just follow the curvature. Okay, just follow the curvature. So this imaginary line, okay, this is an imaginary line, and this imaginary line, it is dividing the stomach along the curvature of the stomach into left 1/3, right, and we have right 2/3, right 2/3. Is this clear? पहले तो फटाफट इतना बता दो मुझे कि हमने along the curvature of the stomach, जल्दी से एक thumbs up दे दो if this part is clear, so that I can start with the lymphatic drainage. इतना क्लियर है तो फटाफट से एक thumbs up दे दो. Yes, Anakala, Dimple, Angel, Surveen, Veer, very good. ठीक है, हमने एक imaginary line draw की है which is along the curvature of the stomach, and it is dividing the stomach into right 2/3 and left 1/3 portions. After that beta, what you have to do? After that beta, what you have to do? Lima, Anushka, very good. Hitesh, very good, very good. The second point that you have to keep in mind, okay, now we have to draw a line over here. Okay, we have to draw a line over here, okay, which is dividing, okay, in the left 1/3, which is dividing the stomach. Okay, draw a line dividing on the left side into upper 1/3 and lower 2/3. Okay, so this is a line dividing upper 1/3 and lower 2/3. ठीक है, हमने पहले एक लाइन खींची along the curvature of the stomach. Then on the left side we draw a line such that that portion, the left portion, it is divided into upper 1/3 and lower 2/3. इतना क्लियर है? इतना क्लियर है? फिर what we have to do, we have to again draw a line. We have to again draw a line. Okay, we have to again draw a line on the right side. Draw a line dividing stomach into upper 2/3 and lower 1/3 into upper 2/3 and lower 1/3. तो ये डिवीजन क्लियर हो गया सब लोगों को. तो इसी तरीके से आई हैव डिवाइडेड द स्टमक इनटू 4 मेन पार्ट्स. इफ यू हैव टू सी इट बेटा, we have, okay, I'll just use another pen over here. So this is the we have the part 1, part 2, part 3 and part 4. क्या इतना क्लियर है सबको कि मैंने स्टमक को इन 4 पार्ट्स में डिवाइड किया है? बिकॉज द रीजन ऑफ डिवाइडिंग इन दीज लाइंस, बिकॉज दीज एरियाज विल ड्रेन इनटू डिफरेंट लिम्फ नोड्स. क्या इतना क्लियर है? फटाफट से एक थम्स अप दे दो, इसके बाद द वर्क विल बी वेरी इजी. ओके, द वर्क विल बी वेरी इजी. यस, क्रिस्मस सेज यस सर. व्हाट अबाउट रेस्ट बेटा? चलो फिर जब समझ आ गया तो फिर आगे फटाफट से इसको कंप्लीट करते. यस, साई कृष्णा, लीमा, डिम्पल, वीर, गरिमा, वेरी गुड. आदित्य, संजना, सत्यश्री, अनुष्का, वेरी गुड बेटा. हितेश, वेरी गुड. चलो, now the first part, okay, the first part will drain. Okay, the first part will drain. Okay, I'll draw it with blue color. Yeah, it will drain the lymph. Okay, we have lymph nodes. These are called as the left gastric nodes. So these are the left gastric nodes. So these are the left gastric lymph nodes, right? So these are the left gastric lymph nodes, right? These are the left gastric lymph nodes. Now this left gastric lymph nodes will drain the lymph into the major lymph nodes, and this is, you should remember, it is the celiac lymph nodes. Okay, it is the, if you remember the arteries, it is very easy to remember the lymph drainage. Okay, it is very easy to remember the lymph drainage. So we have the celiac lymph nodes, right? Now the fourth portion beta over here, it will drain the lymph. Okay, it will drain the lymph. I'm just erasing this because this is like no need as of it. Okay, so I hope everyone has written this, so I'm just erasing it so to make it better understand. Yeah, the fourth one, it will drain the lymph into the right gastric nodes. Okay, it will drain the lymph into the right gastric nodes, right? So this is the right gastric lymph nodes, and again this right gastric lymph node will drain the lymph into yeah, the celiac nodes. क्या इतना क्लियर है सब लोगों को? Even beta, even the lower part, okay, the lower part of the pyloric sphincter and all, they will drain the lymph node. In some cases it will drain the lymph node. Yes, yeah, it will drain the lymph node beta into the hepatic nodes. Okay, it has two drainage beta. The upper part, like it will drain into the right gastric nodes, and the lower part it will drain into the, yeah, we have these hepatic lymph nodes. Hepatic lymph nodes, and these, मतलब मैं notes लिख रहा हूँ, याद रखना, these are all lymph nodes बेटा, these are all lymph nodes. And again, this hepatic lymph nodes will further give all the lymphatic drainage to the celiac lymph nodes. Celiac lymph nodes. So the fourth part has two ways: either the right gastric lymph node or either the hepatic lymph nodes. But anyhow, both of them will finally drain into the celiac lymph nodes. Both of them will finally drain into the celiac lymph nodes. क्या इतना क्लियर है सब लोगों को? जल्दी से एक थम्स अप दे दो शायद सर की। गुड इवनिंग। हम्म, चलो चलो इतना क्लियर है, फटाफट से बता दो। हम्म, चलो डिम्पल क्रिस्मा, वेरी गुड, वेरी गुड। नाउ कमिंग ऑन टू द थर्ड पार्ट बेटा, कमिंग ऑन टू द थर्ड पार्ट। अब ये रिटर्न की जरूरत नहीं है यहाँ पे इतना, तो यस, कमिंग ऑन टू द थर्ड पार्ट। तो रिमेंबर, चलो एवरीवन इज राइट। रुतिका, फनमोद, लीमा, संजना, गरिमा, आदित्य, वीर, साई कृष्णा, वेरी गुड बेटा। नाउ the third part. Now the third part will drain the lymph. Okay, it will drain the lymph. It will drain the lymph. Now suppose this is the lymph. So it will drain the lymph into, remember it is the pancreatico splenic lymph nodes. Pancreatico splenic lymph nodes. Pancreatico splenic lymph nodes. Okay. Now this part, the second part, it will drain the lymph into right. Yeah, it will. Very good, Anakala, very good. It will drain the lymph into the right gastroepiploic lymph nodes. Epiploic lymph nodes. Okay, epiploic lymph nodes. Okay, so yes. Now, beta, now I want over here attention, over here attention. So you should remember, beta, yeah, this pancreatico-splenic lymph nodes. See, second part will also receive the right gastroepiploic lymph node. Also, it will receive secretions from this pancreatico-splenic lymph nodes, right? From the second part also, and like from the third part, it is going to the pancreatico-splenic lymph nodes. It will drain into the right gastroepiploic lymph nodes. So right gastro is receiving from two sources. The second part, okay, the major, and the pancreatico-splenic lymph nodes. Apart from that, beta, it will again it will secrete into, yeah, a structure that is called as pyloric lymph nodes. Pyloric lymph nodes, and these pyloric lymph nodes will further secrete into hepatic lymph nodes. These pyloric lymph nodes will further secrete into hepatic lymph nodes. Is it clear बेटा? Is it clear बेटा? फटाफट से एक thumbs up देके बता दो कि ये समझ में आ गया, so that I can discuss an important clinical correlation over here. Yeah. चलो, अनकला वेरी गुड, एंजल, वीर तोशी, आदित्य, लीमा, सत्यश्री, ऋतिका, वेरी गुड बेटा, वेरी गुड, परफेक्ट परफेक्ट बेटा, परफेक्ट। साई कृष्णा, वेरी गुड बेटा। So you are very well aware with the fact that, yeah, now these celiac lymph nodes, although I will discuss this in thorax part as well, no need to worry about that. These celiac lymph nodes, okay, via intestinal lymph trunk, they will drain into a structure that is called as cisterna chyli. So cisterna chyli basically beta, it is the beginning of the thoracic duct. Okay, it is the beginning of the thoracic duct. And remember, it is the largest lymphatic duct. Okay, it is the largest lymphatic duct. It is the largest lymphatic duct. Okay. Now, what cisterna chyli will do? It will take the lymph upwards and towards the left side, right? Obviously, stomach. Hmm. And it will drain at the junction of the left subclavian and the left internal jugular vein. Okay. So, yeah, cisterna chyli via thoracic duct. Okay. That is the beginning of the thoracic duct. So, again, it will like drain the, yeah, lymph into the junction of the subclavian, the left subclavian and the left internal jugular vein. Sorry, the left subclavian and the left internal jugular, and it is towards the neck. Now, beta, what happens? I have a question, a clinical correlation, beta. In case of gastric carcinoma, now, when I say carcinoma beta, basically I'm talking about the cancer, okay? And gastric carcinoma commonly occurs in the pyloric antrum part, okay? Commonly occurs in the pyloric antrum part, and it is along the along the greater curvature. Now, you already know the greater curvature, it is draining the lymph into what? Pyloric lymph nodes or right gastroepiploic lymph nodes. So, now, the cancer cells from these lymph nodes, basically they will spread via lymph vessels. Okay, they will spread via lymph vessels, and you already know what will happen. They will spread via lymph vessels to left supraclavicular lymph nodes, supraclavicular lymph nodes, and what will happen beta? The lymph nodes of the supraclavicular region, they will become enlarged. Okay, they will become enlarged and palpable. आप उसको palpate कर सकते हो. And this is something which is called as the virtuous lymph node. Okay, this is called as the virtuous lymph node. And this enlarged and palpable lymph nodes, okay, the supraclavicular lymph nodes, this sign where you can palpate it, okay, and this sign where you will see the enlarged lymph nodes, it is called as the Troisier's sign. Many of the time they have asked in the exam, and this Troisier sign is seen in case of gastric carcinoma. Okay, and how it is going, I've already told you. This cisterna chyli, basically beginning of the thoracic duct. Okay, the thoracic duct, it will take the lymph upwards, and it will take the lymph upwards towards the left side, right, towards the left side, towards the junction of the left subclavian and the left internal jugular. Okay, so yes, obviously the lymph nodes, the cancer cells, if it is having like towards the greater curvature, towards the pyloric antrum, these cancer cells from the pylorus part beta, I mean from the pyloric lymph nodes, it will go to hepatic lymph nodes, celiac lymph nodes, cisterna chyli, then ultimately the left supraclavicular lymph nodes they will reach, and the lymph nodes over there will become enlarged and palpable, and that is something which is called as the virtuous lymph node, and the sign is referred as Troisier sign. So I hope this is clear to everyone. Beta, just give me a thumbs up in the chat box that the lymphatic drainage is also clear. The lymphatic drainage is also clear. Chill. So we have discussed like the posterior relations of the stomach, that is the stomach bed. We have discussed the arterial supply. We have discussed the venous drainage. We have discussed the lymphatic drainage. 4 topics are done. Okay, perfect. I hope everyone has answered. Everyone understood. Yeah. Let us now. Okay. So yes, let us now. So this is the same diagram that we have drawn right now, and you already know that we have already discussed this diagram. Okay, so yeah, so the 2 diagrams that I have already discussed with you people. Now coming on to the nerve supply, of the stomach. Yes, coming on to the nerve supply, this is again an important part, beta. Nerve supply of the stomach. So write down. Shall nerve supply. Okay. Nerve supply of the stomach. It is, for example, if we talk about the sympathetic nerve supply, beta. Remember the sympathetic nerve supply. It is from T6 to T10. Everyone will tell me the full form of what is T6, what is T10. And that is something which is referred as the greater splanchnic nerves. Okay, the greater splanchnic nerves. What is the function? Now, when I say sympathetic beta, so you should remember it is vasomotor. Okay, it is vasomotor. Okay. Now, when I say vasomotor beta, it is motor to thoracic 6 spinal nerve. Very good. Very good. Motor to pyloric sphincter. Motor का मतलब क्या? Muscles. Obviously, which muscles are there in the pyloric sphincter? Okay. Tell me which muscles are there. Yes, 6 thoracic spinal nerve. Which muscles are there in the pyloric sphincter? Okay. Now, now it is only motor supply to pyloric sphincter. Yeah, pyloric sphincter. Yes, very good, Satyashri. It is the circular muscles. Beta, rest. The sympathetic one, again, it's an important point. It is inhibitory. It is inhibitory to rest of gastric musculature. It is inhibitory to rest of gastric musculature. And when I say gastric to like inhibitory to rest of the gastric musculature, basically beta it helps in filling. Obviously बात है कि पूरे स्टमक में बेटा in the entire stomach it is having like relaxing वाला state है. No muscles are contracting. What will happen? जितना भी food जा रहा है, it will try to come down. Okay, it will try to come down, right? So yeah, so that is something which is called as the filling of the stomach. And yeah, when I say sympathetic beta, it is the chief carrier of pain. Chief carrier of pain. Now, the ones which are shown in the picture beta, these are the parasympathetic, okay, nerves. And you already know, okay, which cranial nerve beta. Now, I have the question for you people. Which cranial nerve will be like supplying the stomach over here? Which cranial nerve? बताओ जल्दी से, मैंने पहले भी बताया है, पहले भी एम्ब्रियोलॉजी में बताया हुआ है. बता ही नहीं रहे हैं सर. Yes, it is the right and the left vagus beta. It is the right and the left vagus. Fun mode, very good. चलो, एम्ब्रियोलॉजी में आई हैव ऑलरेडी डिस्कस्ड बेटा कि अगर ये स्टमक था तो अगर राइट वेगस था और लेफ्ट वेगस था ना, स्टार्टिंग में याद हो एम्ब्रियोलॉजी में मैंने बताया था स्टमक के साथ ही क्रॉस सेक्शन लेके बताया था. वी हैव द राइट एंड द लेफ्ट वेगस, राइट एंड द लेफ्ट वेगस. सो यस, राइट एंड द लेफ्ट वेगस. सो या right जो है after rotation it will become the anterior vagal trunk, right? It will supply the anterior, yeah. And sorry, the right one will be the posterior vagal trunk. Okay, obviously बात है rotation के बाद क्या हो जाएगा. So remember बेटा, लिख लेते हैं इसको. anterior vagal trunk, anterior vagal trunk, or if I say anterior gastric nerve, okay, it is basically the continuation of left vagus. Okay. Obviously बात है मेरा, इसको अगर समझना है ना तो इसको पिक्चर पे देख लो. ये स्टमक है, मैं क्रॉस सेक्शन लेके बता रहा हूँ. तो ये ट्रांसफर सेक्शन हम लोग ले रहे हैं, और स्टार्टिंग में मैंने जब बताया था कि ये राइट साइड है और ये लेफ्ट साइड है, तो ये लेफ्ट वेगस नर्व हो गई और ये राइट वेगस नर्व हो गई। रोटेशन हुआ एंटी क्लॉकवाइज, राइट वाली चली जाएगी पीछे और लेफ्ट वाली आ जाएगी आगे। तो लेफ्ट वन विल कंटिन्यू एज द एंटीरियर वाला पार्ट, ठीक है, और राइट वाला क्या कंटिन्यू करेगा, पोस्टीरियर, ठीक है, राइट पीछे की तरफ चला जाएगा। सो यस, पोस्टीरियर वेगल ट्रंक, यस, posterior vagal trunk, remember it is the right vagus, okay, it is the right vagus continuation, it is the right vagus continuation, right? So I hope this part is clear, I hope this part is clear. Again, if you want, I will draw the same diagram for you people. I hope this part is clear. So let us draw the nerve supply. Yeah, just give me a thumbs up before that I start with the nerve supply. So yes, like thumbs up दे दो बेटा। चलो, एंजल, डिम्पल, संजना, वीर, तन्वी, अनुष्का, सत्यश्री, आदित्य, साई कृष्णा, गरिमा, अनंगला, कृष्णा, very good बेटा। So yes, suppose let us see, this is the stomach and we are now taking the nerve supply. So yes, this is the anterior vagal trunk. अब एंटीरियर वाला कौन सा कंटिन्यूएशन है, जल्दी से बता दो। चलो, तुम लोगों ने अभी बता ही दिया है। तो रिमेंबर इट इज द एंटीरियर वेगल ट्रंक, और ये लेफ्ट वाला कंटिन्यूएशन है, ठीक है, लेफ्ट वेगस। So this is anterior vagal trunk. It is the anterior vagal trunk which is continuation of the left vagus. Okay, left vagus. Now this anterior vagal trunk, this nerve, okay, will give certain small nerves. So it will give hepatic branch. We have, yeah, celiac branch. Yes, we have the gastric branch which is running along the lesser curvature, okay, which is running along the lesser curvature. So yes, it is somewhat like that. So we have three branches that I will just label for you people. So yeah, the very first one, remember we have the hepatic branch, the celiac branch, celiac branch will end into celiac ganglion, it will form a ganglion, and this is called as the celiac ganglion. Okay, then we have the gastric branch. Gastric branch, it is also called as the nerve of lethargit. It is also called as the nerve of lethargit. It is also called as the nerve of lethargit. And yes, the hepatic branch, beta. Remember, this is again, you have to remember, the hepatic branch will give off the nerve supply to the pyloric part, and that is something which is called as the pyloric branch. So pyloric branch, it is coming from hepatic branch. Pyloric branch, it is coming from hepatic branch. Okay. Now, so this is the, इतना क्लियर हो गया बेटा, इतना क्लियर हो गया। ये एंटीरियर वेगल का बताया, अगर पोस्टीरियर वेगल देख रहा है, आई होप दिस इज क्लियर। इफ वी जस्ट ट्राई टू फोकस ऑन द पोस्टीरियर वेगल पार्ट, पोस्टीरियर वेगल में ज्यादा वो नहीं है, पोस्टीरियर वेगल में ज्यादा वो नहीं है। तो यस, I'll just try to, yeah, हाँ, ठीक है, ठीक है, चलो। Now, I'm drawing it with like dotted lines so that you are very well aware. We have this posterior vagal trunk and it is continuation of right vagus, right? It is the posterior vagal trunk, right? So now this posterior vagal trunk, okay, will continue, right? Will continue, and this is, yeah, We'll continue like this. Yeah, this is also called as the nerve of Lethargic. Okay, this is also called as the nerve of Lethargic. Obviously, when I say Lethargic, it is towards the lesser curvature. Okay, it is supplying the gastric glands. Okay, देखो दोनों sides हो गई ना, both the sides are there. Anterior side भी है और posterior side भी है. तो anterior वाले में we have the nerve of Lethargic, that is the anterior वाला part, it will supply the anterior gastric glands. और पीछे वाला nerve of Lethargic, that is the lesser curvature, it will supply the gastric glands, okay, which are situated posteriorly. So yeah, now which cells are there which produces the acid? Can anyone tell me which are the cells of the stomach which produces the acid? What is the name of the cell? So yeah, they are supplying the gastric glands. The nerve of Lethargic is supplying the gastric glands, and these gastric glands contain one cell which is producing the acid. Can anyone tell me the name of that acid? Okay. Yes, parietal cells, very good. बोलने की जरूरत नहीं अनुष्का, very good. It is the parietal cells, beta. It is the parietal cells. Yes. Again from here, yeah. Again as fun mode, I think fun mode only told. Yeah, we have the celiac branch. Okay, we have the celiac branch reaching the celiac lymph nodes, right? Sorry, celiac ganglion. Yeah, parietal बिल्कुल ठीक है. And one thing that we have to remember over here, there is one branch which is supplying the fundus of the stomach beta, and this branch, it is called as the nerve of Gracie. It is called as the nerve of Gracie, which is supplying the fundus, giving since more like parasympathetic supply to the fundus part. It is the nerve of Gracie. Nerve of Gracie. So I hope this is clear. Okay. Now, beta, again a clinical question that has been asked in the exam. That has been asked in the exam, and I want every one of you to answer. बेटा ये कहाँ कंटिन्यू हो रहा है? ड्यूडेनम में. ड्यूडेनम में. ठीक है. अगर मैं बात करूं ड्यूडेनल अल्सर की, ड्यूडेनल अल्सर की, ओके, ड्यूडेनल अल्सर में एसिड इट इज कमिंग फ्रॉम वेयर बेटा? ड्यूडेनल अल्सर में एसिड इट इज कमिंग फ्रॉम वेयर? Can anyone tell me duodenal ulcer में, sorry, the acid is coming from the stomach only? Stomach से ही acid आ रहा है. Okay, the stomach से ही acid आ रहा है. तो अल्सर हो गया है, मतलब acid का content is reaching to the stomach. So in duodenal ulcers बेटा, yes, gastric secretions है, bile secretions भी हो सकती है, but these are the secondary parts, right? But ठीक है. So obviously we have to reduce the acid content which is reaching the stomach, right? So in that case, what is done beta? We do a highly selective vagotomy. Highly selective. Again clinical essentials. Again clinical essential. Vagotomy. Now when I say vagotomy, vago means vagus nerve. Vagus nerve. Vagus nerve को cut कर दो. Tommy means to cut the vagus nerve. And if we cut the vagus nerve, you already know the highly selective vagotomy. It is done on which nerve? It is the nerve of Lethargic. That is the main gastric branch. So when the nerve is cut, what will happen? The HCl secretion will be less. HCl secretion decreases. Okay. Now, why HCl secretion decreases beta? You already know parietal cells were receiving the nerve supply from this nerve of Lethargic. Now, these parietal cells will become denervated beta. Denervated कहने का मतलब है they will not have any nerve supply. Obviously, we are cutting and removing. Tomy means to cut. Vago means the vagus nerve. We are cutting the nerve of Lethargic, which is supplying the parietal cells. और parietal cells is the one which is producing the acid. HCl वाला part. अगर parietal cells को sensations ही नहीं मिलेंगे तो obviously they won't produce the acid. So if we denervate, okay, the parietal cells, the acid content will be reduced. Okay, so that is why yeah. And duodenal ulcers, basically, obviously the first part of the duodenum is mainly affected because all the acid is coming from the stomach to the first part, right? First part of duodenum is most commonly affected. It is most commonly affected. Is this clear to everyone, beta? Is this clear to everyone? Just give me a thumbs up in the chat box. Is this clear to everyone, beta? चलिए, नर्व सप्लाई भी क्लियर हो गया है. रिकरेंस हो सकता है बिल्कुल. या अनकला वेरी गुड. साई कृष्णा, एंजल, संजना, आदित्य वेरी गुड बेटा. राइट, वेरी गुड. चलो. Sure. Let us now complete the topic by a last and the important topic, that is the that I want to discuss a little bit of histological portion, or I can simply say the structure of the stomach bit. Just one slide more that I will discuss and will end the session for today. That is the structure of the stomach. Okay, structure of the stomach. So the wall of the stomach beta, the wall of the stomach, basically it has four coats. ये हिस्टोलॉजी वाला थोड़ा सा पोर्शन है, अभी थोड़ा टाइम है तो फटाफट से इसको डिस्कस कर लेते हैं. इट हैज फोर कोट्स, राइट? सो इनसाइड या टू आउटवर्ड्स, अंदर से बाहर की तरफ. ओके, इनसाइड टू आउटसाइड. व्हाट ऑल फोर कोट्स आर देयर? Yes, we have mucous membrane. Okay, we have the mucous membrane. Okay, now now this mucous membrane beta, remember it is thick. Okay, from inside to outside I'm discussing. It is thick. Okay, it is soft, it is velvety. Okay, and there are presence of temporary mucus folds. Okay, they are presence of temporary mucus folds. Okay, or these mucus folds are called as rugae. Okay, these are called as rugae. Okay, which are longitudinal in direction. And when I say temporary beta, when the stomach is distended, these automatically these automatically disappear when the stomach is distended. Okay, so yes, now remember beta, the mucous membrane, it consists of epithelium. Okay, and when I say epithelium over here, it is simple columnar epithelium. Okay, it is simple columnar epithelium. Okay, then we have the lamina propria. Okay, can anyone tell me lamina propria is made up of which tissue? And after that we have the muscularis mucosae. The muscle layer. Okay, the second one beta, it is the submucosa. Okay, it consists of the loose areolar tissue. Okay, and obviously it contains blood vessels. Fluxes of blood vessels are there, along with the lymph nodes and nerves. Okay, so the loose areolar tissue along with the blood vessels, the lymph nodes and the nerves, right? So yes. After that, you should remember that we have muscular coat. And these muscular coat are divided into inner, middle and outer. So inner, basically it is the oblique layer. Middle, we have the circular layer. Okay, that is the CML. Okay, and outer we have the longitudinal layer. Yes, fun mode, very good. It is the connective tissue. वो जो क्वेश्चन पूछा था मैंने, या लेमिना प्रोप्रिया, लूज कनेक्टिव टिश्यू. ठीक है, outer longitudinal layer, so it is the LML. Okay, so yes, after that we have the serosa part. Okay, serosa is a thin fibrous layer. Thin fibrous layer. Now, when I say serosa beta, it is actually the visceral peritoneum. Okay, it is the visceral peritoneum that covers most of the GIT, that is the gastrointestinal tract. Okay, now at okay, over some parts of the esophagus, the serosa is actually absent. Okay, the GIT peritoneum is absent, and that is something which is called as adventitia. Okay, that is something which is called as adventitia, right? So this, I hope this is clear, beta everyone. I hope this is clear to everyone. Just give me a thumbs up in the chat box if this is clear. So yes, even if you want me to just highlight this. Sure. You already know, beta, we have towards the lesser curvature, we have certain gastric canals. Okay, we have gastric canals. And remember, gastric canals allow the rapid passage of liquid. Okay, all the liquids actually go through these gastric canals, even if we talk about the alcohol, beta. So, yeah, the gastric ulceration. Okay, ulcers in the gastric region are more prone to the lesser curvature क्योंकि liquids जो है ना सारे ही gastric canal के होते हुए through it directly reaches the small intestine. We often say ना कि alcohol जल्दी absorb हो जाता है. Alcohol is a liquid and all the liquids are actually going down through this gastric canal. Okay, these are all going down through this gastric canal. Okay, gastric canals, these are this allow the rapid movement of the liquid. So yeah, that's why in alcoholic patients basically we see gastric ulceration, and the most common site is the lesser curvature because of these gastric canals which are present. Apart from that, I have already told you there are mucosal folds or rugae, beta. These are mucosal folds or rugae. So these are actually gastric folds. Okay, these are gastric folds. Okay, now now whenever the stomach is flattened, beta, these gastric folds will actually disappear. Basically, they give more surface area for the stomach to take the food. Okay, so they disappear, giving more surface area for the stomach to for foods. Okay, so yeah, and obviously these rugaes are containing certain pits. Now, when I say pits, these are actually the holes which are present over here, and these are called as gastric pits. Now, when I say gastric pits, beta, it is an opening pit for, or this is an opening site for gastric glands. This is an opening site for the gastric glands, beta. It is an opening site for the gastric glands. So that is something that you have to know about the interior of the stomach, or I can say the structure of the stomach, right? The interior of the stomach or the structure of the stomach. Okay. The histological part and somewhat related to gastric ulceration. You can just mention this clinical essential in your notes as well. That gastric ulceration, it is more prone to lesser curvature. It is more prone to lesser curvature. It is more prone to lesser curvature. So just give me a thumbs up in the chat box, guys, that this is done for today. So we have discussed the interior of the stomach. I want everyone to answer that everything is clear for like whatever we discussed in today's session. Yes, Veer Toshi, Surveying Angel, very good. So interior of the stomach, the nerve supply. Yes, Angel Matthews, very good. Satyashri, Sanjana, Aditya, Dimple, very good, beta, very good. The nerve supply, the lymphatic drainage, the venous drainage, the arterial supply, and the posterior relations of the stomach. That is the stomach bed. The stomach bed. So I hope all the parts are like clear to everyone. All the parts are clear to everyone. So yes, now I can feel stomach. Chaliye. Tomorrow, beta, tomorrow again a very important session. In one session tomorrow, I will complete the entire duodenum. Okay, within 2 hours or like 1.5 hours, I will try to complete the entire duodenum. Again, one session, one day, one organ I will complete with everything: arterial, nerve, lymphatics, venous drainage, okay, parts, okay, relations of the duodenum, everything. So, beta, because Kapil मैंने अभी बताया था, it is like the gastric canals are present, and gastric canals जो होते हैं ना बेटा, मैंने अभी बताया था gastric canals जो होते हैं, can you see these gastric canals? These are present throughout the lesser curvature. Okay, these are present throughout these lesser curvature, these gastric canals, and these gastric canals absorb the maximum liquid part. Okay, so yes, yes, if you want my phone number, beta, you can just text me on this particular number. It is 85878 87291. For any particular doubts, you can just text me on these numbers, and tomorrow I will be discussing the duodenum in one shot. Okay, so yes, be prepared for tomorrow. Goodbye, and like keep going, guys, keep going. Okay, चलिए, हैंग हो गया है।